Welcome to today's training on the evaluation in senior living. Senior living is the clinical portion of Matrix attached to our elite site. This is where we house all our clinical. To get started, you will sign in using your Matrix Care SSO sign-in. Once you've logged in, you will see my homepage is set to my evaluations. You can set your homepage to any of the 4 clinical areas, which is either the clinical notes, the clinical evaluations, the clinical forms, or the clinical service plans. I have mine set to evaluations because that's what I use most. Again, you can use your filter to look at your communities. If you're looking at a previous evaluation or you're looking for someone who is a pre-admission move-in, you would want to click your move-in to get those residents. If you're looking for someone who moved out, your filter really filters everything you're looking for. You can also filter what service plans or evaluations you've had certain headers on. So if you just want to see people who have health-related services, you could filter that. But for today, we're going to start at the beginning. We're going to find our resident that we need to do evaluation on. Again, we went clinical evaluation. You'll see here across the top, I can filter by putting the up and down arrow, make them alphabetical. I can do different categories. I can do effective dates. I can do next dues, so I can see who's coming up due, who's late. I can see who finalized forms. I can sort it by points or levels. So there's lots of ways to look at your evaluations. I can also go in and show hide columns because there's certain things I don't need to see. We don't need to see approvals and signing. I don't really care for my apartment numbers. I don't really need to see that. I'm only one community, so I don't really need to see a community. And NRA does not obtain to us. BMP and minutes don't pertain to us. So those I can take off. Some people like their apartment numbers, but you can make it to what you want. I just like mine shorter so I can see everything I feel like I need to see. You can see I have some lates. Again, per state, it's set up per state for which assessment you'll do and how often. I'm going to start with Marilyn Sloan. I'm going to highlight the row of Marilyn. And she's not a new resident, but I'm going to pretend she's new. So I'm going to hit the new button. So if I had a previous evaluation, I would select existing to copy over from, and I would select the last evaluation done. I'm actually going to do the Wisconsin evaluation template just because Wisconsin is the only state that just uses the core questions. Everyone else has some added things for state regulations. So this is like the basic of the evaluation. So we're going to go ahead and save. And you're going to notice if it's a brand new evaluation, we would not have any active care points and we wouldn't have a level yet. But this is nice because if it's a reevaluation, I can watch what she was. And over here, I can see she's in progress. Again, you have some blue buttons across the top, and then you have your category where we're starting with cognition and psychosocial. You'll notice on the left-hand side, I have my in-progress evaluation summary. I also have any forms that may be required, and we'll talk about that in a little bit. And then I have my categories. If I open up the blue side button here, it will tell me every question that's under that category. If I just need to go to that question, I can go ahead and click on it and it would bring me to bathing. It would bring me to laundry. So I can go in and just go to the category that I need to go in. But we're going to pretend she's brand new. You're going to notice that orientation is our first question and it says select one area. So after every category, it tells you kind of what you need to do for that question. The deficit areas are these right here. So there's a few deficit areas because in the questions, it's asking you how many deficit areas above. So if there's 1 to 2, she'd be mildly impaired. So if she had needed reminders, not always able to make decisions. You'll notice that 1 and 2 are out of order. 2 should really be in the first spot and 1 should be in the second spot. And I'll correct that the next time we put out a new evaluation. But for this resident, let's say she has mild impairment. So in each question, there's going to be a box for notes. Notes go over to the service plan. And as we do this evaluation, we're also creating a service plan. So anything you want the aides to see or the other staff to see reading the service plan, you would be able to type in notes. You don't have to, but it's really nice to have some definition for the aides. So maybe I want to use these quick notes, or I could free type anything I wanted to. Maybe I just have to do that. She needs just mild redirection daily. Whatever it is that you want to say. So now you'll see my note here. And we're starting to build that service plan. These questions aren't scheduling pieces, they're just informational pieces. You also notice over here you have your base points and then your calculated points. And these questions do not have any points. The next question is select only one. Do they wander? Do they wander into private areas requiring redirection? So for her, let's say she does wander into private areas needing redirection. Then we want to do an elopement assessment. So this is an assessment, or what we call a form, which is linked to certain questions so that we have these mini assessments attached. You can either wait to the end to do all the forms that are required, or we could do the form now. If we click on this, we go out of the evaluation into the form or mini assessment. And it's just asking you questions. Does a resident exhibit any of the following behaviors? And then you have to use these toolbars to kind of go up and down, and you can pick multiples. So this is a multiple question. Once it's answered, you get a green check mark. This one is saying, what interventions are we doing because they're at a risk for elopement? Well, maybe we labeled the clothing. You can just put an X in if that's what you did. There's only one character. So whether you want to put yes, no, X, whatever it is that you choose to do, you can go ahead and label those. And then if you have any additional information, and maybe she's on a secured unit because of her elopement risk. And so now you see we've answered the questions. We can go ahead and save this. We're going to X out at the top. We're going to give it 1 minute here. It's going to refresh and reopen up. And now you'll see that form required no longer has the red star. We have completed it. So we can continue on with our questions. Behavioral depression, anxiety, we want to select what applies here. You'll see some points are starting to start. So if they need frequent redirection daily, again, it's nothing the staff are going to have to sign off on, but it is information for how to care for the resident. And so there's always some quick notes, or you can free type information over to the staff. So there's your note here. So now you'll see I have 15 points. I can see she's a care level 1, she's 15 points. So we really want to be careful in the behavioral areas that this is something that is well documented and that the family knows that this is something they'll be paying for. Memory care has a broad point span where assisted living and independent living does not. So if we're really not intervening daily, we want to make sure that we are not tagging this for points. Verbal aggression. It could be that they have verbal aggression and maybe it's well documented that it's really every day. It's taking staff a lot of time with them every day, and we want to go ahead and get those points. You're going to see this point is an open white box. And the reason is I could keep it at 0 because I took the points, and really when he is verbally aggressive or agitated, I'm sorry, she, it's really also because she's agitated. So I don't want to double the points here, but maybe it is really separated. So maybe I do want to take the points. So you can kind of also look at that a little bit. There is a section here where if, when I saved it, it said if I'm using 2 staff to intervene, we want to double those points, which is another reason that we have the 15 base points, but maybe I want to put 30 because we do have 2 staff for safety when they're behaving this way. So then I would document 2 staff. Again, there's some nice quick notes you can use. Communication, again, communication doesn't have any points associated with it, but we want to answer it. So if they need some speech assistance, you could pick that. If they're a little bit difficult to understand, you can go ahead and put that in, but we have some quick notes here too that we can use. You can use all, some, you can edit. And then again, if they're a smoker, you would have a smoking form, and we do have regulations per facility, so you do want to add that quick note. And then you'll see that there's a smoking risk form. So again, that's that mini assessment. You want to answer these questions. And then if there is a numbered question, you have to put none or not applicable if there is no answer for it, just to close the question out. And then of course we have referrals. And so maybe there's no referrals needed for this person and they've been smoking, and we gave them all the information about our smoking policies at admission and what is our plan for cessation, and she's going to use the gum. So once you answer the questions, you can go ahead and save it. Yours would be much more thorough. And again, it's going to refresh. And then we'll see that that one is completed. Now we start into activities of daily living. As we get into these ADLs, mobility, nutritional, and health related, there's some scheduling pieces now. If we help them use their eyeglasses, if we have to set them up on a service for them to have their glasses and hearing aids put in, we can pick something that's appropriate. Base points are 10 here for extensive assistance. So we're helping them because of their visual loss or their hearing loss. So maybe they need hearing aids or help with their glasses every day. And maybe we do it morning and night. You'll see this one does not calculate. It's care by. You have lots of choices, but it does default to the resident assistant because that's the one that's chosen most. There is a third party, so if hospice is involved, they could also be involved in the care plan. You can select a shift, but you don't need to. We can just put a time in, so morning and evening cares, perhaps. Duration. Duration just means how long the service is this. And this one is a 10-minute service. Maybe it's a 5-minute service for this person. You don't have to put a duration in, but I'll show you why it's kind of nice if you do. We'll get to that in a minute. But again, there's some quick notes that maybe this is what the aides need to do either in there. Because this is now scheduled, this is something that the aides will sign off on every day at 8 and 8. If you just set it to a time or a shift, it will default to the beginning of the shift. The aides from feedback on multiple facilities really appreciate the time. So I tend to put times in for them. And the time is just a guide. It doesn't mean they have to do the cares at that time. Again, we're under dressing and grooming. Select all that apply. If we have 2 staff for that category, we can double those points. And we do not put mobility in this section. So it's not how they get out of bed. It's really the assistance for dressing, grooming. So here, you'll notice that we have limited and oversight takes about the same amount of time, 15 points or 15 minutes. So here's another scheduling piece. We have base points of 15. It is a daily service. We're gonna put it twice a day. It will calculate the points as soon as I click off the square, care by resident assistant. I may put a shift in or I may put a time in. I prefer times. If I do, I can bypass the shifts. And this is a 15-minute service. And I know that because my base points is 15. If I felt like this person who maybe they have Parkinson's needed more time, I could change this to a 40-minute service, 40 points and put 20 and 20. I can use the quick notes or I can go ahead and type in whatever I choose for this resident. So maybe I could write that they have Parkinson's. Is very slow, but able and then I could write to help shave. And maybe when going to bed, turn on bed alarm. So maybe they have a bed alarm or something. Anything that you're doing for them going to bed or getting up, it doesn't have to just be under dressing and grooming, but if you have safety features, you should put it here so the staff are reading that. And then always make sure we're making our quick notes personalized. So now you can see there are 95 points in a level 6. We have 8 levels. If we have TED holes, Job stockings, anything that takes that extra time, we can click here. Again, maybe they just put them on, but they can get them off at night. If you have a quick note of estimated time, we do like that put in here for the aides because they see how much time it's supposed to be. And that helps with their documentation. And you just save that. You can see this as we go. Bathing is a little bit different. Bathing is assisted to shower, and it's usually a weekly service. So it'll default to weekly for you. And you can put how many times a week in there. And again, you click off to the side, it'll calculate your points. It defaults to resident assistant. Now the difference is you can pick the days of the week. So it only shows up on these days. And maybe one bath is in during the day and one bath is in the evening. And we say it's a 30-minute shower. Now there is something new called the scheduling assistant, and that is in every scheduling piece throughout Matrix Senior Living. And so this kind of helps us schedule and kind of find times where we have more downtime. It is newer, so it's not exactly perfected yet, but we're hoping to get that a little bit easier for us to navigate around. Maybe I just want to see all the bathing. So right now it shows me on Monday through Sunday at 6 to 7, I only have one bath on Tuesday. From 7 to 8, I have nothing scheduled. Oh, I have 2 people scheduled Sunday from 7 to 8, and it's these 2 residents. And then you can see that, oh, I overscheduled. I have 4 baths this day, and I don't have any this day. So it's kind of trying to help you navigate some of your baths or cares. So it's kind of a nice newer scheduling piece. Again, I'm going to use the quick note of the estimated time. And I'm going to go ahead and save that. And then, of course, the notification for 2 staff. You'll see here I left off on bathing, so now I'm going to go to bathroom assistants. And there's 3 different assistant levels of toileting. So if they need to be assisted with toileting up to 3 times a day, up to 6 times a day, and every 2 hours. Most residents who just need help up to 3 times a day are probably people who need help at night for safety reasons, or they've been falling, or they're just weaker. Up to 6 times a day is more average for our assisted living clients. Not too many of them need toileting every 2 hours. And we don't necessarily schedule their toileting, but we let them call us when they need toileting. So it's up to 6 times a day. Some communities just choose to put 3 occurrences. It doesn't matter about the points, or you could put 6 if you have exact times. And then they just put the shifts. So every shift just knows that this resident will ring for assistance. So you can put anything about their incontinent products, any toileting habits you kind of want to put in here for your notes. And then you can go ahead and save that. And this is just a little notification that we don't include how they transfer again here. We have mobility further down. We do have special care needs. So if they have a pendant or call device, you might want the staff to know that they have a pendant. Not every community has pendants, or every person. Then there's colostomy catheters, there's oxygen. This is skin integrity. So if they do have a good history of pressure ulcers and wounds, we might want to do a Norton scale on them. If they have a new onset of a skin impairment, and we're opening the evaluation because it's a change of condition, so it's a pretty significant wound, and we're looking at mobility and toileting, and we're changing services, then I would check number 58. And of course, this skin integrity event would then click open. We have weekly weights and daily weights, and you just need to know what your marketing is, because if you have vital signs monthly or quarterly included, we would not bill extra unless it's above that. But we don't typically schedule in here. We just get the points in here. So if it's weekly, one time a week, you can put your day of the week. You can put that you want it maybe on the night shift before they get up because it's for a diuretic. And I might tell them this, but I almost will say document vital signs in the EMR, because they're going to document it on the EMR, not here. This is just the service of the weekly weight, getting the points for payment. Again, you have mobility. There's standby assistance of one, or assist of 1 to meals up to 2 times a day. There's standby assistance of meals up to 3 times a day or more. So we're, it's those that don't go to breakfast or lunch, and maybe 1 meal a day, and then they like to go to an activity a day. I would click this to get those 30 points or 45. There's another one for if they always require assist of 1 without transfers. And of course, that's something I would want every shift to know. So I would make sure I put it down for every shift. Sometimes you'll see the schedule collapse and you think it's not scheduling. But if you have this piece here, it's a scheduling piece. So then you just need to open that up. And again, I'm just going to let each shift know because it'll default to the start of the shift. And I want them to know that to make sure pendant is within reach. Any kind of fall risk stuff can go here. Anything that makes sense. You're going to notice a falls risk now form that clicks open. And I'm not going to do it here because I want to show you what it looks like at the end also. There's also another, here's an exercise program. So if you have something like 3 times a week, or, things that happen after you get those therapy referrals, you're going to notice this is a weekly service of base points of 15. These points are for daily, and so we have to remember to come in and change it to a 4 or a 6. So how you know that is a weekly service of 15 minutes is 2 points, and a monthly or a 30-minute service is 4. So we'll put 4 here. And then we'll put what days. So this would be maybe 9 a.m. and 2 p.m. And then you would type in what is the exercise program. And we can change that and put those calculated points in there for a reminder. These assisted devices are just letting you know what's used. There is a side rail. If they're using a side rail, you're going to get a side rail assessment, and that's for the bed. And then you have your falls risk. So just answering the questions if they're a risk for falls. And then safety checks. So if you're just doing those safety checks outside of the required housing, so every housing person has maybe 1 or 2 that are required in your marketing material. If I just have 1 and that's all they need, and I have to do a daily housing check on them, and maybe I do it at a meal time, you'll see there's no points. And so I'll just put 12 p.m. for the noon meal. And then I might write, if not located, notify supervisor. And then you can put in what diet they are. We do sometimes do different diets. Most of the times in assisted living, they're regular, but they may have something else. And then do they need help in the dining room? Those would have points and scheduling features. So now we're going to move into health-related services. Health-related services, the first section is the medication treatment setup. You can select one unless they're having an outside pharmacy, that would be an additional 4 points. Again, this is a weekly service. The first one is we don't manage meds, so then you would pick this and you would just skip the rest of this section. The second one is if we're setting up by just, they're totally independent, but they're using our pharmacy, so we are bringing their meds to them. They get ordered through us, but we don't set them up. They take them independently, we just deliver. The third one is we either set them up with med cards or we set them up in a med caddy for them, and we either administrate or they take themselves. And you'll notice one's a simple setup, one's a complex setup. If we pick one or the other, it's a weekly service that we want the nurse to do. We need to change the care by to a licensed nurse, RN, LPN, whatever it is you do. We need to pick a day of the week that we're going to do this med setup. And then I always put a later time in. And the reason being, we have a shared to-do list with the aides. We don't have a separate to-do list right now. So if you put it a little bit later, they tend to not sign off on our treatments. This weekly setup is really a quality and assurance check, a med check by the nurse. Regardless if the meds come once a month or every 2 weeks or whatever your system is, we still want the nurse for quality to go into that med cart and look at those staff that are doing those unlicensed med passes to make sure they haven't made errors, to review any PRN usage, follow up on anything that we see kind of out of the ordinary, check for expired meds, verifying the narcotic counts for minimizing diversion, checking if there's mischarting, all those things, and then making sure we have enough meds for the following week until we check again. This is very important for Benedictine quality, and it's more about just putting meds in a med cart. It's about that whole oversight of the nurse. And that's what they're paying for. They're paying for the quality check. So this is a weekly service by the nurse, not the RA. And this is not for medication administration. So you're counting, how many meds are we managing? Simple or complex? And then of course, if we use an outside pharmacy, we're going to get 4 more points just because it does take a lot of time to order through the VA and other such pharmacies when it's not a regular. Then the next section is about how many times a day are we giving their medications. And this is an insulin, so we don't include insulin in here because it's a separate section. But if we're providing reminders or just recording, but our hands are off, we would take 96. If we're actually giving the meds, then we would pick 97. It is a scheduling piece. It's usually daily. And then you have to see how many med passes are we using, are we giving them? Typically 2, 3, 4, whatever to calculate those points. And then you want to put the time of the med pass here. And they're signing off on the med pass itself. They're not signing the meds, but it's triggering them when they're on their to-do list that they have a med pass to go to the EMR to pass these meds. Then again, you want to use the quick notes of the estimated time, and that they'll have the specific instructions in the administration in the actual order. And if they have concerns, they need to let the nurse know. Because they are unlicensed, we do want them to have that information. If they're resistant to taking meds, it may not be all 3 med passes. It could be, but maybe it's just one time they're resistive. And so maybe it's just that night pass that we want them to make sure that they're reapproaching if they're unable to give the meds as ordered. You can put whatever in here that makes sense for your staff to read if they're very resistant. Probably more of a memory care type of situation. And then if they have complex meds, again, may not be at every med pass, but maybe just one med pass. We want to get a little extra time or points for that. It's very important to put things in like reminders to wait those 5 minutes between eye drops, because if they have 3 eye drops, that's very time consuming. Or inhalers or whatever it is. So you can give exact instructions here, but it would also be under that medication in the EMR. Lastly, under the medications is the diabetics. And again, maybe we're just recording for 5 points. So we'd put how many times a day. Maybe we do the blood sugar, but they self-administer their insulin. We're just kind of keeping an eye on it. Or maybe we're doing everything. And so what I tell nurses when they're setting this up for the aides, that this is the service. And again, they have to go to the EMR to do the AccuCheck and actual insulin. So I usually write see EMR. And if they have AccuChecks 4 times a day and insulin 3 times a day, I just want them to know that. They don't need the details here. It's just how many times a day. We're only going to bill them the 4 times because the AccuCheck and the insulin, those 3 times are one service. So we wouldn't charge them 7 times. We would charge the higher of the 2 because it's going to be one service. And again, I forgot to schedule, but I'm going to forget to schedule on purpose. And we'll show you that in a minute. Then there's a coordinate with hospice services. It's nice to have the agency name and who their contacts and a kind of a brief overview of their services. So the aides know if they come on Mondays or Fridays, or it's nice to have a little schedule in there for the aides. If they're expressing a lot of pain or you feel it's uncontrolled, you could click this and then your pain assessment would open. 108, I would kind of just skip over that. If they can self-perform, I think this one, oh no, it's not scheduling. So this is just kind of like an informational thing. But if we're gonna make their bed and open their blinds and remove garbage and all that, we would want to go ahead and schedule the aides to do that. Again, we would put the estimated time, and maybe it's 8 a.m. and 8 p.m. and 9 p.m. Maybe she likes to go to bed late. Oh, it didn't save. Okay. And then laundry, you need to refer to your marketing material for your laundry. It really is important because some people have it included in the rent and some people have it not included in the rent. And then you would pick if we change their bed linens weekly or bi-weekly, do we do their laundry? And they have 8 points for that, or is it 0 points? The last section here is a vulnerability. Most of the vulnerability, you're selecting all areas that they're vulnerable. So if they're vulnerable because their environment isn't safe or free of clutter or it has impaired judgment, you just click on the question. There's some quick notes to describe the vulnerability. So you could just put in why they're vulnerable. Then I could put in the intervention and plan, and I could write in what we're going to do for them. And then the goals are pretty much written for you, but you can go ahead and change those. So you just really want to go through your vulnerabilities, and the aides have access to this. This is going to show up on their service plan for them. So then they always have access to their vulnerabilities or individual abuse prevention plan. That is why that's so important to have it here. If they're unable to evacuate from the building is important. And then you just have to click on here that you interviewed the client, yes. Information received from, maybe the H&P chart, family, however you got all the information. And then, of course, you would do observation and assessment of the client. And you don't need to put notes in every question. And the last of the questions is, do they appear to have some vulnerability, none, requiring interventions, or are there signs of maltreatment? So of course you would have to pick one of those. And then do they have a risk for others? And so this person does not. You can see now that I have 3 forms that are required at the bottom. I've done 2 as I did my evaluation. I just have my falls risk. So I can come in here and I can say they're alert and oriented. I'm just going to answer the questions. Again, there's some drop downs for multiple questions here. So maybe they have a couple things. And then the next question, ambulatory, it's your typical falls risk. And you have to kind of click off of it to see the question underneath it. So sometimes they kind of cover it up. And then of course the evaluation is minimal falls risk, has pendant to alert staff, maybe has 2 night safety checks. So you can put your interventions in here, what you did about it. You also have additional room here to write. And then you have to say, did we do any referrals, or maybe PT and OT are involved. And then there are new residents, so I'm going to initiate the plan of care. I can see everything is here. I'm going to save. I'm going to X out and I'm going to refresh. You have now just filled out your first evaluation. I know that I have 331 points and they're care level 8. Once we're done with this, we have to send for approvals. We don't have approvals in Benedictine, but other people who use this system do. But it is building the service plan. So the service plan has been created. That's why it's important to send for approvals. We now have our service plan already done for us. We don't have to do anything else. We're going to finalize this. We're going to go ahead and choose our type of assessment. If we do initial, it could create the next one, which would be 5 or 14, whatever your state has for you. But this we'll put as initial and we'll hit finalize. It's just going to say, are you sure? And we'll say yes. And now it'll give you a warning that it was finalized successfully. Go ahead and go back to evaluations. Now we're going to go to clinical and a service plan. You're going to see Marilyn has an in-progress service plan. She has an active old one based on the previous evaluation. So we're going to highlight this, and I just want to modify it for a minute because I want to see if I scheduled everything, because sometimes I forget. So I can see here that I did put shifts in, I put times in. I put shifts in, I put times in. I didn't put a time in here or a shift. So that's going to default without a time or a shift. That's going to go ahead and default to midnight. So I'm going to go ahead and put 8 p.m. here and hit save. So now it saved it. And then I'm going to go do the laundry, and I got the laundry, but I thought there was one more thing I forgot to schedule. So you see, you kind of have a last minute to come in and see what it looks like. Okay, so now I'm happy with it. I can go ahead and finalize it, put today's date in, and hit OK. It's going to now override the other one. Oops, I put in the wrong date. Must have clicked wrong. So now it's going to override the old one, and this is now over in Kerecis for the aids to document. So everything we just put in now, they see it. Oh, I think it knocked me out. Hold on. So now when you go into Kerecis, you'll see all those items for Marilyn will show up here. So let me go to Marilyn Sloan, and here's all her items that we made today. And you'll see when they click on them, how they see their notes that we put in. And here's their view service plan. And this is that service plan that we did. Oops, just doesn't like me today. Let's see if it finalized. And that is the end of doing your first evaluation and service plan. So thank you guys for joining. If you have questions, I'm Linda Johnson, and you can always reach out to me. Thank you.